Welcome to the So Why podcast with Step Care Solutions. This podcast aims to explore issues and challenges, as well as ideas and solutions leading to strengthening support for mental wellness and recovery. My name is Alexa Bull, Director of Co-Design and Knowledge Exchange at Step Care Solutions, and I will be your host for this episode. As a part of a CIHR grant, the Province of New Brunswick embarked on the implementation of Step Care 2.0 in 2019. The provincial implementation began with implementing one at a time therapy across the province. The impacts were evident with decreased waitlists and both positive client and provider feedback. The Province of New Brunswick is well on their way to creating a person-centric, open access mental health, addictions, and substance use health system. Today, we are joined by Bernie Goguen, the Director of Adult Services at New Brunswick's Department of Health, where he is working on various projects on improving continuum of care in addiction and mental health services. Bernie is a psychologist with over 30 years of experience in helping individuals with substance use and mental health issues. He's a graduate of St. Thomas and Carleton universities and worked for several years in Provincial and Federal correctional services. He has held various management positions with Horizon Health Network's addiction and mental health services, including a Detoxification Treatment Unit and an Opioid replacement treatment program and community health services. Welcome, Bernie, and thank you so much for joining us on the So Why podcast. We're so happy to have you with us today.
That's my pleasure. Thank you for inviting me.
Amazing. So I'm going to ask you a few questions about the implementation that you've been working on of Step Care 2.0 in the province of New Brunswick. So the first question that I have for you is, what led to the decision of implementing Step Care 2.0 in New Brunswick?
Yeah, well, I think we've known for a while. We're always hearing from clients and the public and our partners kind of some of the challenges that the addictions and mental health system has been facing in New Brunswick. And two things really kind of stand out from that feedback we've been getting. One of them is that services are not easily accessible in a timely manner. So when people want to reach out for help, especially that sort of counseling, help with general anxiety, depression, those sort of more common mental health challenges, that services aren't that timely. That's kind of one of the key things that we heard. And the second thing that we heard, I think, is from multiple different venues, is that it's a system that's difficult to navigate and difficult to understand. Even people who work within the addictions and mental health system have a difficult time understanding kind of how it fits and how it all fits together. So when we've known that for a while, and we also did 3 kind of major service reviews over the past few years. We reviewed all of our addiction services, both inpatient and outpatient. We reviewed some mental health services as well. So we talked with clients, directors, managers, frontline clinicians, did some public consultation as well. And some key themes kind of really came out. And some of these included things like there's a need for more education and training in the workforce. We need to kind of modernize the services as well to make sure that they're all evidence-based practice and up to best practice standards. We need to continue to integrate addictions and mental health services. Although we've done a lot of progress in New Brunswick, there's still some work to be done in integrating addictions and mental health services. And not just those 2 services, but with the broader healthcare service as well, because clients or patients who come in also have medical needs and other types of needs as well. So we want to make sure that a service is kind of integrated and works well together. And some of the other things that came out clearly was a need for a clear vision of what addictions and mental health services are and what they do and kind of what they look like. And also that the system needs to be kind of interconnected and kind of not working in silos, right? As it sometimes happen. And this isn't just in New Brunswick. I think it happens all across Canada, and it's just the way that the systems were built over time. So when we kind of had all this information, of course, we'd always been in touch with Newfoundland and Labrador and followed closely their evolution with Step Care. And we thought that Step Care would be a really nice model to produce that kind of vision of addictions and mental health services and be kind of the framework for an effective, broad continuum of care. So that kind of helped with one of the challenges of having a system that is difficult to navigate. And with step care principles of having open access services and, care first idea, we also knew that one at a time therapy or single session therapy or, that kind of quick access therapy would really be an important part of that. So all those things kind of together, all the service reviews and information we gathered, plus the idea of step care and open access one at a time therapy, that kind of all kind of blended in really nicely. And from that, we put that in our 5-year addictions and mental health action plan, with step care really becoming the cornerstone and the vision for addictions and mental health services, and the creation of that continuum of an interconnected step care model of services. So that's kind of how it came about.
That's amazing. And I think, all of the sort of challenges that you listed off from what you were hearing from folks are pretty common. As you mentioned, they are pretty common challenges that happen within systems. And it sounds like such a tremendous thing to tackle, lots of moving parts. So I'm wondering if you can tell us a little bit about how the change in New Brunswick sort of got started, and what was it about the change that went really well?
Yeah, I think how it got started, really, even before we had our addictions and mental health action plan, we started talking about step care and about one at a time therapy or single session therapy as potential solutions and ways of kind of moving things forward. So, we started talking with directors and managers and talking about this as a potential vision, and really just kept talking about it. And there was a lot of interest and a lot of buy-in, and people started to see that this could work and started to see, how this could work. So we had that kind of vision. And then, of course, the pandemic happened. So things really kind of took a kind of sideways turn for a while anyways. But I think we always kept that kind of plugging away in the back of our mind that we need to do something. We need to have a vision. We need a continuum of care that is effective and broad and evidence-based and client-centered, all those kind of key things. So that's kind of how it really started, small, and then we just kept talking about it. And then when the time came to really start kind of doing things and implementing things, it was still during the pandemic, of course, but we really knew that we wanted to start with something that was going to have an immediate impact. We decided that step care is great and grand, but if we start there, it might take too long to really start to fully implement that idea as a concept and as a model. So we started with something tangible. So we started with the implementation of single session therapy or one at a time therapy in both a walk-in format or a rapid access appointment. So that was our first tangible, let's move ahead with this. So, and of course, the folks at Step Care were amazing. They helped us with training and setting kind of all that up, that groundwork. So that's kind of really how it started.
So you mentioned a little earlier on that some of the challenges were around navigation, lots of sort of procedures, difficult, even for those who work in the system, to kind of figure out how it all fits together and how to really support people in their wellness journey. So I'm wondering, how did you sort of approach simplifying some of these procedures? And you mentioned rapid access. So how did you kind of move toward that rapid access model?
Yeah, we've known for a long time that we wanted to provide services as quickly as we can. I mean, that's, a basic premise of providing services. And we had done some progress with having a kind of 3-day assessment wait time. So somebody would call and we would get them in an office or talk with them within 3 days to do that assessment. And that was a huge leap forward. But ultimately, it still led to a kind of bottleneck afterwards. So we became quite good at assessing people quickly and identifying their needs. But quite often they ended up kind of on a waiting list, especially those with maybe more mild or moderate symptoms or issues such as anxiety and depression, or not the seriously acute type situation. So that was kind of part of it. So we knew that we needed to start looking at providing care first. That principle of step care is care first, right? So we needed to kind of switch from that assessment to that treatment, and that's where the one at a time therapy really came in terms of simplifying things. So one of the things that we did is we switched that requirement of needing to do that assessment at the first point of contact to providing that care first, that one at a time, come in, let's talk to us. We'll help you right now with whatever is top of mind, whatever you're struggling with. We're going to help you right now. And if need be, that conversation, that interaction can turn into a more kind of structured assessment if need be, and then help the person be navigated onto more longer term services if needed. But it was that kind of switch, and we still don't have that down perfect. We still don't know all the time when somebody comes in, is it going to be a kind of single session, one at a time therapy, or is it going to be a more intake assessment to navigate to the other services? So we're still working that out. So it's one of those things that takes a while to kind of get right. In any kind of change management process, is you go in one direction, then you need to kind of step back and correct and move forward again. So, but that was really kind of to simplify things. And, also our kind of previous intake assessment had like a list of 80 questions or so that we'd ask people. So we'd already simplified that and kind of downsized it to really just collect the least information as possible to still be able to provide the services. So that was also an amelioration of services as well. So that's kind of how we try to simplify things. And of course, there has to be a kind of support of policies and guidelines to do all this. So that does take time as well. But that's really kind of how we try to simplify things, is just go in and talk to somebody and get the help that you need right away. And then we'll deal with the assessment later on and navigate you to the right services if need be.
That's great. Thanks for sharing a little bit about that, because I think sometimes that can be such a daunting process, and then implementing that change as well across a province is quite a big endeavor. So I'm wondering, what was challenging about managing this very big change?
Yeah, and that's a good point, because it was a provincial implementation. So that creates a variety of issues, and also has some advantages, to be quite frank. We are fortunate that our system is not kind of multi-layered and kind of patchwork, in that the majority of the more formal addictions and mental health services are delivered by one or the two regional health authorities, Horizon Health Network and Réseau de Santé et Vitalité. So we do have great partnerships with them, and they deliver most of the addictions and mental health services. So that does have an advantage in terms of change management, but it is broad in scope in terms of a provincial implementation. So one of the things that worked well is we had some really early adopters and champions in Carleton, which is one of the smaller cities in the northern part of the province. So they were really interested in starting one at a time therapy and moving forward with that. So they started that probably about 6 months before we moved to a provincial kind of implementation rollout. And they did an amazing job. Like, we saw right away the results. Reduced waitlist, almost no waitlist, high client satisfaction level, staff engagement. So, and that also allowed us to really try out documents and policies and procedures. So we really, really learned a lot from that kind of early adopter pre-implementation. So that kind of made things a lot easier. So many lessons learned. But of course, it was still the pandemic, right? So the health networks were in kind of crisis mode, short staffed. There was staffing issues even before the pandemic, but the pandemic really highlighted that and kind of made it worse on multiple levels. So that was kind of big challenges. People were, focused on so many other things, but I got to give credit to the two regional health authorities. They kind of bought in, and they really wanted to move forward with this as well, because they saw the value of it. So that was kind of one of the challenges as well. Coordinating training from a provincial perspective is also a challenge as well, and a bit of juggling there. But I think some of the things that really helped us is, with this kind of process, we really tried to do a kind of project management approach. So we had people with project management expertise as part of the team, and we also hired a change management expert. So somebody who really knew the change management world and could really kind of guide us through processes, the steps, and kind of how to make sure that the change that you make is sustainable, because that is a key thing. A lot of projects fail because they don't have that sustainability piece at the tail end. So we build those right up front to make sure that we had all that stuff. And communication is so important. I mean, I think everybody who's involved in change management knows that, but can't emphasize that enough. You have to communicate and over communicate and keep communicating. It's such a key thing. So those are kind of, in terms of a change management, those are some of the things that we saw. But I think, having people in project management, change management, and that communication is so important. And of course, we had a small but dynamic provincial implementation committee, again, with leaders and champions And we didn't force anybody to start doing one at a time therapy. We wanted kind of people who were volunteered and interested and into it, who believed in it right away. And that made the change management a bit easier as well. Because there's enough work to go around for everybody. Not everybody needs to do brief interventions. There's a need for longer term intervention as well.
That's so true. I love sort of the key elements that you pulled out. You mentioned the challenges, but then you also mentioned, how did you overcome those challenges? What did you do to kind of conquer those? And, having some dedicated staff and some dedicated people with expertise in the area, as well as identifying those champions. And I love how you said those started with those who are interested in doing it, because you're not there to force people to do anything. You're there to see who's interested. And as you mentioned, we still have lots of room across the continuum for lots of different types of interventions. And so I think that's a really important thing to mention. And I love the little story about Campbellton and how they were early adopters, where things could be tested out and tried and see how things go as you're implementing on a broader scale. You mentioned about some of the impacts being seen early on in the early adopters. And I was wondering if you could expand a little bit on that, where you tell us a bit more about some of the impacts of the broader implementation of the one at a time thinking.
Yeah, sure. When you start on these projects, you kind of always hope that they're not going to fail, right? Because I've been involved in some projects that started out well, but then ultimately kind of collapsed or failed for a variety of different reasons. So you always have that kind of fear that this is going to happen. But when the results in Campbellton started kind of rolling in, and then we saw the same thing provincially, it was just so reassuring and rewarding, and that sense of relief that, okay, what we're seeing here is kind of what they saw in Newfoundland and Labrador, what they've seen in other places as well, with when you start implementing brief services like one at a time therapy. So it was really like, whew, it's working. It was like that kind of feeling. So some of the things that we saw right away, or rather quickly, is a significant reduction in waiting lists. We had a significant amount of people waiting for services. As I mentioned, we were good at providing that assessment, but then people ended up kind of waiting to be assigned to a clinician for that kind of longer term therapy model. So within 6 months, we were able to reduce that waiting list by, I think it was 62% across the province. And that number has stayed at a reduced level in terms of people on the waiting list. In some of the smaller centers, there's no waiting list anymore. People can just kind of talk to somebody right away and walk in and get the services they need. But in the bigger center, there's still a wait list for particularly for more longer term therapy. But it has stayed at that reduced level, so it's not continuing to grow as it had been for several years, in fact. So that has been a huge impact as well. Other things that we saw as well is for the implementation project, we asked clients who were interested to complete a survey after they had that initial one at a time therapy session. And I think it was 92% of them said they were either satisfied or very satisfied with the service that they received, with the plan that they came out with. They felt supported, listened to, and they were very amazed at how quickly they were seen. And, there were some comments that I didn't know so much could happen in one meeting, and it helped me so much. So many great comments. And, we've been doing client surveys for a while, and it's quite interesting to see the amount and the number of actual comments, not just kind of circles on the rating scales. It was really quite interesting to see that as well. And there's a few kind of negative comments. I'm going to need more sessions, that kind of stuff, where this is not quite what I need more. So we saw some of those, but overwhelmingly people were happy to be seen quickly, to feel supported, and come up with a really good plan as well. So that was another kind of positive impact. And a third kind of client related impact was before they came to the session, clients felt either worried or very worried about what was bothering them. I think it was like 65% felt that way. They reported on that survey scale. And after that one at a time, that initial one session, I think that number went down to 8 or 10% still said that they felt worried or very worried about what was troubling them. But it was a significant reduction in worry after even just that one session. Now, it doesn't mean that things have been resolved for them. Of course, there's probably still some other issues that they need to focus on and carry through with the plan that they came. But they felt that sense of relief and being heard and being listened to, and left, I think, feeling more confident and positive about what had happened and them moving forward. So I think that was a really good impact. Some other things that we didn't quite expect, we noticed as well. So I think one of them was the impact on clinicians, although we always try to focus on the client and providing services, but the workforce and the clinicians are very important. And we want to make sure that they have a good experience with these change initiatives as well. So one of the impacts that we saw is clinicians, a large proportion of them felt kind of a sense of renewed hope in working in addictions and mental health services. They were having an impact on clients right away, no longer having that kind of burden of the wait list on your shoulder, because we all feel that when there's a big waiting list, right? We all feel that weight. So those are sort of some of the comments that we heard from clinicians is I feel renewed, reignited. This training has really helped me. I'm providing, clients help right away, right after that session. I feel I really helped somebody as opposed to, doing an assessment and putting them on a waiting list. It's kind of a more hopeful approach. So I think that was a big impact as well. And I think also as part of that sustainability piece for change management, we have a community of practice now for one-at-a-time therapy. And that I think leads to a kind of provincially connected group of folks who kind of work together and share and learn from each other and collaborate. So I think that also has really had an impact across services in addictions and mental health as well. And I think one of the other things that we saw, although we knew it, but it was an important lesson. I think we realized that OAT, one-at-a-time therapy or single session, is not everything. We do need to continue to focus on the longer term services, the services with more intensity as well. And we've heard that loud and clear from various groups in the province as well. OAT is good. It's great. It's a good addition to the service, but there's so much more that needs to be done. There's other gaps, especially along those higher intensity services and those higher needs. So we need to continue working on that as well. But yeah, one-at-a-time therapy, that open access is just kind of a starting point as we move forward and implement step care to focus on all the intensity of services, not just one or two.
That's fantastic. I love hearing about the comments. I think the comments are always so impactful when you actually hear from someone who is accessing the services or someone who is delivering the services. How is that impacting them? How is the change impacting them? So those are all really, really powerful. And I love how you mentioned that, hey, you know what? One-at-a-time therapy doesn't necessarily answer everything, but it is a great tool. It is a great option, especially to reduce wait lists and get care first, get care right away. And then I love how you mentioned, still building those higher intensity services and having longer therapy available for those who need it and want it as an option across the continuum. And, with one-at-a-time therapy as well, the person could come once and need to come back again and be free to do so. But they don't necessarily have to pre-book 6 appointments or that type of thing. So I think that's really important to understand as we're reducing wait lists that, hey, like some people will need more and that's okay. So I love how you highlighted that within the impacts and what you heard. So you mentioned continuing to build that full continuum of care. And I'm wondering what that looks like for New Brunswick. So what are your next steps? What are your plans as you start to implement that full Step Care 2.0 approach with the full continuum?
Yeah, that is so important. I mean, we can't kind of stop there with the reduced wait list and quick access or more rapid access. So some of our next step, of course, is we've just started with a kind of provincial steering committee, which involves a variety of partners and stakeholders. So of course, people from the regional health authorities, other government departments, various non-government agencies who provide services in addictions and mental health landscape, Indigenous communities, Indigenous wellness teams as well, people with lived experience. So we have a variety of partners at this table who are going to be the kind of provincial implementation steering committee. And we learned quite a bit from one-at-a-time therapy implementation that we really need to have a kind of project management approach to this as well. We can't just leave it to chance. We can't just kind of do it on the side of our desks as well. So we've continued that kind of project management idea and have a change management expert as well on this project. In fact, the same one. So there's a lot of knowledge carryover as well. So we're in the process of kind of developing a project plan of how we're going to kind of make this all happen. And some of the things that we're going to start with is really kind of start slow, but kind of gradually kind of build over this process, because we know it's not going to be a 6 months implementation like we did with one-at-a-time therapy. There's going to be a longer term endeavor. So some of the things that we want to do over the next 6, 8 months, maybe a year, is really start to develop a shared understanding of what step care is for New Brunswick. So, there's the kind of standard generalized step care model that we've all seen, but what does it look like in New Brunswick? I think we need to kind of tailor make it for us. And some of the things that we're going to do in that kind of project is look at what are going to be New Brunswick's guiding principles for step care. There's the kind of standard ones and client-centered care and, all that kind of stuff, right? Care first, all those really good ones. But what does New Brunswick need to add to that or build to that to make it our own? So that's kind of one example of it. So to really have that shared understanding in New Brunswick. We also need to focus on, of course, the co-designing the model and building the model together. That's going to be a big piece of work as well. And that, of course, involves doing kind of system gap analysis and system identifying what's currently in place and what's connected and what's not connected, and how can we develop pathways to connect all those things together. So just that kind of defining and co-designing step care and, what are the levels are going to be and what is the model going to look like visually? Because some people don't like the step idea and some places have developed a circle. So we're going to have to kind of see what we want to do with that, of course, in a co-design fashion, and, continue to focus on access and navigation as well. That's kind of going to be part of that as well. So there's a group working on that piece. And of course, step care and one-at-a-time therapy are kind of significant changes in how we provide services. So we also need to look at all of our kind of policies and guidelines as well and tweak them, adjust them, or kind of rebuild them in that step care lens and that kind of care first approach and attitude as well. So that's going to be another large piece of work. So even though while that all that kind of system level stuff is going on, we need to continue to improve services and add services where we can. So we're also working on some other projects. For example, we're looking, we've been working for a few months now on implementing an outpatient withdrawal management service. So not everybody needs to go to a building like a detox center to receive withdrawal management services. We know that there's a subset of people who need withdrawal management services who can safely do it from their home environment with, the right support and monitoring from a physician and a team. So we're kind of building that to continue to broaden that continuum of evidence-based care as well. So we're continuing to do those kinds of things, even as we work on things at a kind of systemic level. And of course, step care continues to grow and broaden. And I think we need to, be open and include things like population health and social determinants of health in a kind of model, because it's not just about addictions and mental health services. It's looking at, the whole of the person and the whole of the system and how it can kind of work together to really provide the best service for that person when they come in through the door. And of course, we want people to be able to step in and step out of services as needed, and also step up or step down, depending on what's going on in their lives and what level of support that they need. And another piece, I didn't really talk about this at all, but I think I just want to give a shout out and acknowledgement to Memorial University. They've been a really important partner in all of this. Their research experience, their knowledge, their help in kind of developing knowledge exchange tools has been great. And that kind of whole research element has been really beneficial to us as well. So it's been a beautiful and great partnership, and we've all benefited from that work. Shout out to them.
That's amazing. Yeah, it's great to have that research element sort of built in as you're implementing to pull out those lessons learned and those impacts and really see what's working, what's not working, and where to sort of evolve the implementation. And one thing that struck me as you were speaking was just the open-endedness of it all and the sort of the spirit of inclusion, like the spirit of really including diverse perspectives in your planning and implementation of that full continuum. You mentioned the steering committee holding many diverse perspectives across the system, including people with lived experience, Indigenous perspectives, to really sort of define and shape what it could look like for New Brunswick, and really being flexible with that and not saying that you have all the answers right now, but that you're so open to hear from other folks across the system as you shape it together and really explore, what does our visual representation look like? What's really important to us as a province? How can we really reflect the uniqueness of New Brunswick and the communities within? So I love that, and taking that co-design approach to really figuring out how you can make these changes in a way that best suits the communities that you really hope to serve. So I think, that really struck me as you were talking, just sort of that open-endedness. of next steps. And I think that's really exciting.
Yeah, thanks. Yeah, thanks for those comments. I think working in government, I think we're trying to learn and trying to do things differently. And it's easy for us to go ahead and just kind of make plans and, move things forward. But I think we've learned that the better way to do it and the best way to do it is to be much more inclusive and involve as many different voices and perspectives as we can. It's perhaps more complicated and more time consuming, but I think ultimately we end up with a better product and a better service model or continuum or whatever we're kind of working on. I think we'll end up with a better end result for everybody. And I think that's kind of what we're all working towards.
Well, I, for one, am excited to see what's going to happen and how things unfold and how everyone sort of shapes the system together in New Brunswick. I'm looking forward to how things evolve. And I want to thank you as well for joining us today and just sharing a little bit about your experience in the province of New Brunswick, creating this big systems change.
Well, thank you for inviting me. It's been my pleasure.
Thank you once again for joining us on the So Why podcast with Step Care Solutions. For more information on the Step Care 2.0 model, the Wellness Together Canada portal, as well as links to resources mentioned in this episode, please check out the show notes below. Thanks for tuning in once again. We look forward to having you back next time.